Welcome back to Breakfast Television on this rainy Thursday morning, and I'm joined by Dr. Preetha. This morning we're talking about children and diabetes and the diagnosis of that, and we're talking about type 1 and type 2 and the importance of a lifestyle change for parents and what that means. And so first and foremost, Dr. Preetha, what is type 1 and type 2 diabetes?
So when people think of diabetes, people often think that it's associated with a bad lifestyle and being overweight, but actually that's not necessarily the case. And in type 1 diabetes, it's actually an autoimmune disease. What that means is your immune system usually fights off bad things like infections, viruses, bacteria. But in an autoimmune disease, your immune system fights off something within your own body. And in type 1 diabetes, that's the pancreas. The pancreas makes something called insulin. Exactly. And insulin is the hormone that regulates your blood sugar. So if you are missing insulin, you're not able to regulate your blood sugar well, and that results in diabetes.
Is there a big difference in type 2?
Yes. So type 2, on the other hand, is the disease process that's more associated with having a higher body mass index. And also there's lots of genetic and ethnic predispositions to type 2 diabetes.
A lot of people say a lot of the times black, West Indians, Indians. Yeah, okay, so
exactly.
that's where the difference is.
That's it. So they're two very different actual conditions.
Okay, and you know, we're talking about this. Some people at home might be saying, diabetes, I mean, who's really being diagnosed? Which children are really being diagnosed with diabetes? Is this common? Do you see this a lot at the hospital?
We absolutely do. So if you look at the incidence of type 1 diabetes in Canada, there's over 300,000 people in Canada who live with type 1 diabetes. And if you take in children alone, I give you an example at the Montreal Children's Hospital. We follow several hundred children with type 1 diabetes. And we do see type 2 diabetes as well. It's probably becoming increasingly common, but in children we see type 1 diabetes a lot more.
And what should parents be looking for in terms of symptoms? Is this something that you'll be able to notice in your children? So change?
The classic symptoms that we see for type 1 diabetes are drinking a lot, like very, very thirsty, going to the bathroom a lot to urinate, sometimes even waking up at night to go to the bathroom and wetting the bed even.
But that sounds a little bit normal in toddlers, no?
It could, in toddlers it can be, but when you really see that, it's excessive. So more than just the normal drinking too much and going to the bathroom too much. So you'll really notice a difference. Sometimes there might be weight loss, you can have nausea or tummy pain as well.
And do you want to contact your doctor immediately? Is this a serious thing?
Immediately. So if you notice symptoms of drinking too much, peeing too much, weight loss, that would be a reason to see your doctor immediately. And these are the kinds of cases that would have to be tested right away. You don't even wait till the next day. If you have those symptoms, it's really important to seek medical attention right away.
And so parents are probably going to be worried. Now their child has been diagnosed with diabetes. Does that mean a lifestyle change? Does everything have to change in this kid's life?
So when you have type 1 diabetes, you have to, it does require a change. You have to actually test your blood sugar
regularly.
A minimum of 4 times a day is what we usually ask for. In addition, you have to inject insulin, and that may be 3-4 times a day, or sometimes even wearing an insulin pump.
And that could be difficult for children who are afraid of needles.
It can be, but it's incredible how children are adaptable and how they really can cope. Sometimes they cope with illness better than adults do, actually. I'd say most of the time. So though it's a lifestyle change in a way, the key is that kids with type 1 diabetes can do absolutely everything that their friends could do. They can still play sports, they can still go trick-or-treating and eat birthday cake. So though it changes their lifestyle in certain ways, we want them to actually, there are children who live with diabetes, but diabetes doesn't define them.
And finally, is this a disease that's going to carry into adulthood?
So right now there is no cure for diabetes. Hopefully there will be soon. But yes, they do have to continue testing their blood sugar and taking insulin through adulthood. But if they control it well, they could actually prevent complications from happening later on.
Well, Dr. Preetha, some great tips there on children with diabetes, type 1 and type 2. Big difference between the two. A lot of people don't know that. So thank you so much for sharing all that information and the facts on diabetes.